Now we'll discuss about the lateral ventricle. First of all, we'll make a diagram. This is cerebral hemisphere. Here is position of lateral ventricle. This is lateral ventricle. This is C-shaped in position. Here is position of third ventricle. Here, this is position of fourth ventricle. From here to here, this is cerebral aqueduct. So this is third ventricle, this is lateral ventricle, and this is fourth ventricle. Here is interventricular foramen of Monro, through which this lateral ventricle communicate with the third ventricle, and this third ventricle communicate with fourth ventricle through cerebral aqueduct of Sylvius. This is cerebral aqueduct of Sylvius. Now we'll make another diagram of the ventricles. This is another diagram. This is another diagram of the ventricle. Here is from here to here. This is third ventricle. This is interventricular foramen. Here, interventricular foramen. This is lateral ventricle. This is C-shaped lateral ventricle. This lateral ventricle has body from here to here. This is level of splenium of corpus callosum. From here to here, from interventricular foramen to splenium of the corpus callosum level. This is body. This part is anterior horn. This is inferior horn. This is posterior horn of the lateral ventricle. This is fourth ventricle. Here is fourth ventricle. Here, from here to here, this is cerebral aqueduct. So this is another view. Here only ventricles are present and other tissue are removed from this view. Now we'll make only lateral ventricle in separate diagram. Here is lateral ventricle. This C-shaped. Here is position of interventricular foramen of Monro, and one structure related to this here in the floor. Here is C-shaped caudate nucleus. This C-shaped caudate nucleus, here it forms floor, and here it forms a roof of this ventricle. It lies here in the roof, it lies here in the floor. This lateral ventricle extends from its main part, extend from this interventricular foramen, this is level of interventricular foramen to splenium of the corpus callosum. Here is position of corpus callosum. This is position of the corpus callosum. So corpus callosum has, this is genu, this is rostrum, from here to here this is rostrum, this part is body, and this posterior part is splenium. So it extends from this part, interventricular foramen, to splenium of the corpus callosum. This part is the body or central part of the lateral ventricle. And anterior to this, there is anterior horn. This is anterior horn. This is anterior horn. This is central part or body of the lateral ventricle. Here is a trigone. This is trigone. It is most dilated part of lateral ventricle. It is known as atrium, also known as collateral trigone. This is atrium or collateral trigone, and this portion, this is posterior extension of this lateral ventricle. This is posterior horn. So this is posterior horn. Here is inferior extension. This is inferior horn. This body, a central part, is present in parietal lobe. This extends into frontal lobe. This extends into occipital lobe, and this extends into temporal lobe. Another important thing. Here is amygdaloid body. This is amygdaloid body. From here, stria terminalis arises. This is stria terminalis. This is stria terminalis. And here is position of thalamus. This is position of thalamus. So these are some important relations of the lateral ventricle. Now, in second part, we'll discuss about the relation of this portion body.